a normal innie.
Pops out. I can pop it out.
Can you?
I'm not a trick.
Party trick. So we've got an innie with a couple of old piercings in it.
Yes.
Put it all on the table.
The colour of the skin is nice and even. There's no sign of any lesions. There's symmetry, right? The abdomen is symmetrical. It is a normal flat shape. There's no abnormal hair growth. No, well, we mentioned the piercings. There's no moles, no stretch marks. What else are we looking for?
Discoloration.
Discoloration? No, none of that.
Redness. Swelling.
No swellings, no sign of ascites, no sign of any blood vessels.
Blood vessels.
There's no pulsations in there. If you've got someone who's anorexic, you can see their abdominal aorta pulsing. So we haven't got any of that. No herniation. I think we've covered all of that. Now, can I'm going to pretend I've got a stethoscope on. Oh, can I have that one? Thank you. Now, I'm going to be listening for 5 to 30 sounds in each quadrant. This is going to be a bit.
I was going to say it's probably going to be cold, isn't it? Is it done?
I'm not going to listen.
Yeah, okay.
So, first of all, are you in any pain in your abdomen?
No.
Okay. Now, I'm just going to be listening in each quadrant for 5 to 30 sounds. 5.
He's giggling.
5. 5 to 30 sounds. 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 So that's auscultation done. Now we're going to do a light palpation. Now, if any of this hurts, like literally, you tell me, because I've got to go down about 1 to 2 centimetres. Now we start in the lower right quadrant, all right? Here. Is that tender? Nothing sore here. So this is just a little screening palpation.
So this is the light one?
Light.
Maybe there for a while.
Nothing? No, and I can tell because the look on her face, there's nothing. What you got to do to get treatment when you're a therapist. Now we're going to do deep. Now I've got to go down about this deep. You ready?
Yeah.
Now that's appendix and ovary. Nothing.
It's a little bit tender.
A
Is
little
that
bit
bad?
tender. No,
Okay.
no. No, I'm
Is that
going up.
normal for them to be like, it's a bit
Yeah, it is. Ascending colon, tender. Up to the next one, more ascending colon. Notice how I'm keeping an eye on her face.
Are we verbalising what the anatomy is actually
You
doing?
do. So ascending colon. Now I've got to go in and do your liver.
Yeah.
Now listen to what I'm saying. Okay, I've got to go and do your liver. It could be really sore. And I've got to go in quite deep. I'm going to have to get 2 breaths. So on the first breath, I'm going to put my hands in when you breathe out, and then you're going to breathe in again, and on the out breath I'm going to go in even deeper because I'm testing for liver and gallbladder. So if it starts to hurt, you let me know, but I'll be able to see from your face as well. Deep breath in and out. How's that?
Good.
Another breath in. See how I'm not taking my hands away? And out. No?
That's good.
See how deep my hand is in?
Yeah.
Right?
Oh, wow.
Yeah. So if there was a big enlarged liver, I wouldn't be able to get it there, right?
Okay.
So there is no hepatomegaly. And the gallbladder is fine. Over here we've got some pancreas and stomach.
Would she feel tenderness if she had hepatomegaly? Or would she, you can tell, but she's like, no, can't feel my liver.
Yeah, if you'll feel it.
Yeah.
Again, don't look stressed. Right? Note hepatomegaly and you go, whoa. Tender?
A little bit.
Yeah, it is a little bit tender there. Now we're going to do spleen. All right? So this leg has to come over here because we've got to, yeah. Now we put our hand behind here, right? And then we get our hand here, take a deep breath in, and letting it out. Just one more in. I've got terrible garlic breath.
Oh, you're okay.
See how, is that sore?
A little bit tender.
But I can't feel any spleen in there. Excellent. So we've done spleen, there's no sign of splenomegaly. Now we're going down to descending colon. This is probably last night's dinner.
Probably.
Descending colon and left ovary. And that's done. Good.